everyone. Welcome to the scientific community session on developing a successful research program and advocacy abstract. My name is Linnea Zimmerman. I'm an assistant professor in the Department of Population, Family, and Reproductive Health, and am the PI of PMA Ethiopia and Deputy Director for Research for the PMA project, both of which are large-scale survey projects that measure key indicators of reproductive health. And I'm also the co-chair of the scientific subcommittee. I'm joined today by Sarah Whitmarsh of Advanced Family Planning. Sarah leads the communication strategy for AFP. AFP is an advocacy initiative within the Gates Institute in the Department of Population, Family, and Reproductive Health at Johns Hopkins Bloomberg School of Public Health. And Sarah is also the former co-chair of the Advocacy and Accountability Subcommittee for the 2018 Icfp. And then finally, we are also joined by Dr. Vinit Sharma, who is the Senior Regional Advisor for Reproductive Health and Family Planning at UNFPA's Regional Office for Asia and the Pacific. Dr. Sharma is a passionate advocate for the health of women, young people, and disadvantaged populations, and an award-winning expert and respected thought leader with nearly 3 decades of technical experience working in multicultural environments. And Dr. Sharma is a member of both the scientific subcommittee and the implementation subcommittee for Icfp. So before we start, I want to just give a few brief announcements and an overview of the session. The 3 videos were provided in advance of the session. The videos had specific guidance for submission to each of the track, and we're hoping that people were able to watch those videos in advance. They are available on the website. Where the design of this session is to take Q&A from the audience, answer any questions you have that either arose from the videos or that were not addressed in the videos. So if you do ask a question that we know is directly addressed by watching the videos, we may ask you to just refer to those and continue on to other questions. But we encourage you to raise questions regardless. We will spend about 20 minutes on each track. So we'll start with answering questions that may be specific to the research track before moving on to advocacy and then ending with program implementation. But we do recognize some of those questions may be applicable across the different tracks. So we may go back and forth or answer questions that apply to all of the different tracks as they arise. Please ask your questions in the Q&A format, the Q&A forum that is at the bottom of the screen. So we will, there's 2 boxes and it says Q&A. We'll be answering the questions from there rather than from the chat box. This session is being conducted only in English and there is no live translation. If you prefer to view the session in French, we have a simultaneous Francophone session. It is being offered right now, and you can join that by leaving this webinar and joining from the link that's on the website, on the Icfp virtual convening website. And then finally, if you would like to tweet specifically about this session, we have our own hashtag, and it's hashtag ICFPSCI. So like science, ICFPSCI. All right, so with those brief announcements, I think we will just move on to Q&A. And so this is really an opportunity for us to engage directly with you. We don't have any pre-prepared remarks or presentations. So if anyone has any questions, please feel free to ask them. Kate Rademacher asks, if Icfp is postponed until 2022, how will this affect timelines and processes? So it's a great question, Kate. We were anticipating someone would ask it. So right now, the Icfp steering committee has not made the final decision. They are certainly weighing the option of delaying the conference because the safety of participants is the #1 consideration for the steering committee. If the conference does continue in November as originally planned, we will be making announcements about the timelines ASAP, and we will be extending the submission guidelines accordingly. So people will have at least a month to submit. If the conference is delayed, the date has not yet been selected. If if it is delayed, but we will also be communicating about those timelines as well. So I can't give you specifics right now, unfortunately. What I can say is that we will absolutely make sure that those timelines are communicated as soon as we can. Kate says, for the Rwanda ICFP, it seems like it was harder to get panels accepted versus individual abstracts. A lot of work goes into panel presentations, so can you discuss the weighing of abstracts versus panels? Absolutely, that's a great question, and is not one that we covered in the video, so thank you for submitting that. The panels, I would say that a lot of the challenges that we had with the panels is that when submitting a panel description, you have to submit a general description of the panel as well as individual abstracts. And each of those components needs to be complete. And the ICFP website, when submitting, has specific sections. For many of the panel submissions, parts of the submissions were left blank. I can't say that that's true of every panel submission, but I do know that that was an issue with the reviews last year. And that may have been because of needing both the individual abstracts from presenters as well as the panel description itself. So there was a fair amount of incomplete data, unfortunately. Some other considerations are for the panels to cover a variety of organizations. Many panels, I believe last year or at the last ICFP, were organized by one organization and had speakers from within that organization. And so it's a priority to really make sure that the panels engage with a lot of different speakers. The follow-up question from Kate is, does each reviewer get fewer panel slots to approve, meaning is a heavier weight given to individual abstracts? I'm not exactly sure of the best way to answer that. So I wouldn't say that there's a heavier weight given to individual abstracts. The number of abstracts that we get, we will, it's hard to anticipate the number of abstracts that we will get, especially this year, and with the considerations of being able to attend in person or virtually. So it's a little bit hard to really anticipate what weight will be given moving forward. In an ideal world, assuming that everyone is able to participate in person, we will, once we have the number of submissions, we will rate those, and based on the number that we consider to be high quality, we will organize them into sessions. I wouldn't say that there is necessarily a greater weight given to the individual versus the panel abstracts. I think it's just a matter of it being relatively more challenging to organize a thematic panel that has a clear theme and contribution, as well as the abstracts from 4 or potentially 3 to 5 different presenters. I think that the logistics of that is often harder to manage and communicate. And so it's perhaps easier for individuals to communicate their own abstracts. I would not say, however, that they are weighted more or less strongly. And the last thing as well is we are hoping this year that each of the scientific subcommittees will also be able to help review and organize some of those panel sessions. And so ideally the panel sessions will be able to be coordinated and supported so that there's more cohesion and a greater ability to get those accepted. Saleh asked, what are some important topics for researchers to focus on after FP 2020 and the initiation of FP 2030? Do we have proposed tracks for ICFP? Yes, so all of the tracks are available on the website. If you go to not the virtual forum website, but the ICFP 2021 website, there is a list of tracks there that are posted. I can't necessarily speak to what is the most important research question. I think that really depends on your own research ideas. But I do know that the theme of the conference is universal health coverage and family planning. So there will certainly be a focus on integration of family planning into universal health coverage. Sarah, do you have anything you want to add to any of the questions so far, or Dr. Sharma?
No, I think you covered them well. The other interesting thing I think we've done in recent years in terms of individual abstract submissions is that by having 3 types of abstracts, the program, research, and advocacy, we've been able to organize a panel that touches on all 3 perspectives of a common theme. And so that helps round out the sessions, so that even if you don't, even if your panel isn't accepted, your preform panel, sometimes there's another opportunity to have a very thorough, comprehensive panel through your individual abstract.
Thanks, Linnea. Thanks, Sarah. Well, with the past experience, you have already answered most of the questions. I would just say that all abstracts have good chances of being accepted if they have been well written, they are concise, and they restrict to the word limit. And they should be appealing. That's more important, and they should be interesting. Otherwise, most of us, all of us are involved in scientific research. But if it is clear and if it follows a sound scientific methodology, there's no reason why it should not be accepted. Thank you.
Thank you. Are there any questions on the organization? Oh, sorry, I do see there's a new question. Once abstracts have been accepted, will templates or guidelines be provided for the preparation of posters or talks? No, I don't believe that we provide templates. We can certainly discuss with the organizers as to whether or not that's the case, but most presenters, I think, generally prefer the templates of their organizations. So we don't provide specific templates. That would be something that you would discuss with either your organization or create on your own. And that's the same for both presentations and posters. Another question is, climate change is becoming an urgent and emergency issue. How does FP fit into this discussion? I think, Dr. Linnea, that this is certainly true. We are, the Icfp sessions this year, I believe, do include at least a subtopic of climate change. I would have to check. It's been some time since we confirmed the tracks. But that is certainly an issue that we know is coming to the forefront, and a lot of people have research interest in that area. So I don't believe that there is a specific track for climate change, but it certainly can fit within some of the larger themes of the track. And so we would encourage you to submit any research that you've been doing, or research, advocacy, or program implementation that you've been doing that relates to that question. While we wait for a question, I'm just going to pull up the track list so that I can have that prepared. I see that we do have another question. It seems that I missed the date of an individual abstract submission deadline and the word limits of the abstract. So you have not missed the submission deadline because of COVID. We have had to postpone the conference, as you know, and we are still in discussions of whether or not it is possible to move forward with the conference in November. Until that decision is made, and it should be made very soon, we're not opening up for abstract submissions because we don't want people to put in the work that it takes to prepare an abstract only to have to close the submissions and delay again. So we will be announcing that shortly, but currently the submission process is not open and the timelines are not set. If we do move forward with the conference in November, the deadlines, the submission process will open very soon, and the deadlines would be in approximately March or April. You please don't quote me specifically on that because we're still really finalizing those details, but we'll ensure that there's at least 1 month for preparation. As for the word limits, those are included in the video. Each of the videos has specific guidance on what the word limits are for each section, and they're also available in the abstract submission instructions on the website. Anita asked, if our abstract or panel can apply to more than one track, should we just use our best judgment to choose one or apply to multiple tracks? And will there be an option to propose a panel with virtual and in-person participants? That's a great question, Anita. So ultimately, yes, you should use your best judgment, but I believe you can you can identify 2 tracks that you would like to submit to. You should prioritize the first track is the one that you would prefer. I think you can identify a second track during the review process if it's clear that there are certain tracks that if you have submitted to a track where it doesn't seem quite the right fit, the track organizers do discuss that, and there's a time period in the organizational process where if there are abstracts we feel like would align in different tracks, then we will communicate about that and move abstracts accordingly. And then will there be an option to for panels to be live and virtual? I'm not going to answer that definitively right now. I would say that we're all moving in the direction of certainly opening up for more engagement virtually. And so I would say that that's a very good chance, but I don't believe at this point the logistics of that have been confirmed. And so I wouldn't want to give you the wrong information. But I would say that that's certainly something that is on the forefront of the organizers' minds.
And just to jump in, I think this is a combo virtual, not in person, but a combo, pre-recorded and in-person Q&A. And so I would encourage you at the end of the 2 days to use the evaluation to give us feedback. I think this is the first time the Gates Institute is doing something like this. And so that would be helpful to help us as we're thinking through some of the options for Thailand.
Yes, absolutely. Will abstract submissions be considered if manuscripts end up being published before the conference takes place, assuming it is postponed? So yes, I mean, I think as long as the manuscript is not published when you are creating and submitting the abstract, we cannot, neither can any other conference, control the timelines of submission. So if the abstract that is submitted, if that manuscript has not yet been published, then if it is published before the conference, then you can still present. You cannot submit an abstract from a paper that is already published, however. Is there any plan to publish the presented papers in a journal? In fact, the Icfp 2018, there is a paper that summarizes the abstracts that is available on Gates Open Research. And Gates Open Research does allow for the publication of papers that were presented at Icfp. I believe there is another session that the Gates Open Research staff will be facilitating, and I would definitely encourage you to go to that session and ask questions there about that process, because I do believe that they will be supporting the publication of abstracts and papers in Gates Open Research. And I'm just pulling up the themes, the tracks for the next conference. And I will read through them very quickly, but I definitely encourage all of you to go to the website, because it will be more interesting than me reading through 15 or 16 different tracks. Universal health coverage and family planning is the theme of the conference, and so it of course has its own track. We will also have a track specific to the impact of COVID on family planning and reproductive health. There will be a track that focuses on returns on investment and the demographic dividend. And then there are several tracks that have been tracks at previous conferences and which have solicited a large number of abstract submissions and interest. And so those include demand generation, social norms and behavior change, fertility intentions and family planning, gender equality, empowerment and reproductive rights, improving quality of care, expanding access to family planning, advances in contraceptive technology and contraceptive commodity security, integration of family planning into health and development programs. And this does include discussion of climate change as well. So there is a sub-theme there of integration of reproductive health and climate change programs. Sexual and reproductive health and rights amongst adolescents and youth, men and family planning and reproductive health in humanitarian settings. I believe that there would also be opportunity for submission to there, there's a sub-theme of natural disasters in family planning and reproductive health, faith in family planning, social and economic disparities in family planning use and services, and then advances in monitoring and evaluation. So those right now are the 16 tracks. We anticipate that those are unlikely to change, but when we formulated this list of tracks, we didn't have a COVID-19 track, so can't always anticipate what will come a year from now. But at the moment, those are the 16 that we anticipate will be the foundation of Icfp. Will abstracts for systematic reviews be considered by evaluators, or is there a preference for original research? I would say that in general, there is a preference for original research. I think abstracts for systematic reviews can be considered. We don't have any restrictions on that, but in general, original research would be likely preferred. That said, if it is a systematic review of something that has not been well researched, and has the opportunity to really provide a succinct and high quality summary of a key topic, I think that would still be of interest to interviewers, or to reviewers, sorry. It looks like we're about 20 minutes in. I think most of these have been fairly general, but I am going to turn it over to Sarah if there are any questions that are more specific to the submission of research, or sorry, of advocacy abstracts.
Maybe as background, while we're still waiting for a few questions, I think if it's been a few years since you've been to an Icfp or submitted to an Icfp, you might be surprised to see this third type of abstract. It is somewhat of a new format for us. Advocacy and accountability became a formal conference subcommittee in 2015 and was spotlighted as a track for the first time at the New Sedua conference in 2016. However, it was just one of the thematic tracks, like the ones that Linnea just read out. But beginning in 2018, we decided to integrate it into all conference tracks, partly to, at that time, respond to the need for the then upcoming Family Planning 2020 deadline, and the recognition that advocacy is a bit of a community of practice of its own, with lessons to share for everyone. So now, with it being a third type of abstract submissions, this allows organizers to formulate panels and presentations that touch on, all three areas: research, program, advocacy, and how they're woven together in different thematic tracks. So that is somewhat of a new approach. We did that in Rwanda with success, and so we're looking to do that again at the next conference. So to clarify, the three areas are separate submissions or woven together. So as best I recall, when you submit an abstract, an individual abstract, you get multiple choice, and you have to select which of the three types of abstracts you are submitting to. There will be advocacy, which I am discussing here. There are program submissions, and there are research. So the type of your abstract, you need to select which one you feel best represents the subject that you're submitting. And as Linnea mentioned previously, you will also be asked to identify a thematic track. So under this type of abstract, which theme best aligns with the topic you're submitting? These are two different choices that you're making in the submission criteria. Advocacy and research could be proposed together or separate. Not sure I understand that one, but maybe I covered that when I said you can't pick both research and advocacy together. You do have to submit one or the other. However, if you're doing a preformed panel and you're submitting many different types of organizations under a common theme, then you could select both an abstract and a research type abstract together under your preformed panel. But when the organizers behind the scenes with the individual abstracts go to formulate the sessions that are in the program, they do look to see how best they can align these individual abstracts so they fit together and make sense and flow together in the sessions. It will be important for the advocacy track to have family planning and a nexus approach, meaning looking at family planning as cross-cutting to humanitarian development and peace building. I think that's a great point. Thank you, Dr. Linnea. Is evidence required for program and/or advocacy submissions? That's a good question. I'll tackle that for advocacy as best I can. Absolutely, as we outlined in the video, there's the different types of the abstract sort of sections. So we have advocacy intervention or activity tested. We have the methodology and the results or key findings, as well as the policy or program implementation. So those are common sections across all the all the abstract types. And so if you are doing an advocacy submission, yes, there's some, evidence required. It's not necessarily as rigorous as like a, original sort of research type abstract, but it's helpful when you have background evidence on the population or type of people you're working with, the scope of your advocacy or accountability effort, any research on the methodology, how many people undertook this advocacy effort, what were your results in terms of there's a financial commitment or a policy change, are there any evidence or data around that, including the potential impact of that? What is the population that could be affected by that policy change or funding increase? So there are different lenses you can take to the advocacy submission that could require and could be strengthened with a lot of data and evidence. And maybe I'll pass to Dr. Sharma to talk about the program. Is evidence required for program submissions?
Thank you. It's very interesting. We have divided into advocacy and program and research, and all of them overlap. Research, it's a research based on program. It could be a research that leads to advocacy. So it's always it can never be delineated. You just cannot say this is pure research or pure advocacy or pure program. A program has various components starting from policy, from providers, to a place where the services are being provided, the products. So, and then all this could lead to research, all this be based on research and leading to advocacy. The important point here is what has been your focus? Has your focus been on how the program is being implemented? What are the bottlenecks in the program? How can the bottlenecks in the program could be addressed? What needs to be done at the policy level? That is, then you are talking about a program. But if you're talking about the bottlenecks and how these can be addressed, and then talk about advocacy, well, your first question was program. So, it is, you are the one who can best decide what was the original question, the hypothesis that you started with. Was it to make a program better by advocacy, or by working on the program, or by working on the workers, on the health workers, or the products? So it will depend on a number of factors at the time when you started thinking about that research. And of course, it can be, as everyone pointed out, it could be an overlap. But let us try to focus on what the research question was. The other important issue here is, if you do not have the final answers, it doesn't mean that you cannot submit an abstract, because the results might come after a while, after weeks, months, or years. But if you have a methodology, you have a research question, and you have some initial findings, well, that can still be submitted as an abstract, because there's something new that people will learn from your methodology or from what you are doing. So again, I'll come back to what I've said earlier. Let's try to make it clear. Let us try to make it interesting, and let us try to make it focused on what we are focusing on, what we are concentrating on. Thank you.
I have a question, Sarah, for you.
Oh.
So as a person who does fall fairly squarely into the research bucket, I guess, in terms of reviewing an advocacy abstract, what would you say really makes an abstract stand out as an advocacy abstract, where you're not necessarily going through the the details of X people were selected and follow-up rates were this and this and this. What details really make it an advocacy abstract stronger?
That's a really great question. I think when it is very clear that a before and after snapshot, a before of what you were hoping to do with your advocacy effort that you undertook. What was the situation before you undertook, whether it be, a financial commitment, a policy change, whether it was trying to get more visibility for family planning. Be very clear what situation you went into, what you did that was perhaps innovative or different than a typical advocacy effort, and then what really changed afterwards. And in particular, I think it's interesting for us in advocacy to know what really swayed a policymaker or decision maker to your side. This is a something we're all trying to understand. We can generate lots of research, do lots of programs, but what really energizes someone to take that action? And so kind of understanding the thinking behind decision making, policy making, innovative approaches that might involve unconventional tactics, I think are always very interesting. Influential voices, young people, using the voices of women who are typically seen as beneficiaries, being involved in advocacy. I think these are all very interesting things that we are still at the early stages of learning about. So those are things that I look for when I review them.
For those of you who are participating but you haven't yet had a chance to watch the videos, please do continue to submit questions, and we're happy to continue to answer those as well.
Mm-hmm. And I did, before I prepared for this session, I did take a look at what were some of the highest scoring advocacy abstracts from the 2018 conference, just to give people a flavor of the types of advocacy abstracts that have been successful in the past. And I think that this is a recommendation that's true for, program research and advocacy, to take a look at the last conference book that publishes all the abstracts and see which ones were accepted. You can sort of get a flavor of what was a successful type of write-up, what we're looking for, some different types of sessions that were presented. And it also helps you if someone in 2016 or 2018 submitted something that's very similar to what you're doing now. It allows you to try and innovate what is the new perspective here that I'm doing, so that you have something that's a little bit different when you're submitting it to the reviewer. But some of the interesting advocacy and successful submissions we had in 2018 were efforts behind getting a new contraceptive accepted into a country's method mix. This was using a community-based family planning program to include emergency contraception. We had a great abstract around expanding task sharing policies so that certain health providers could take on new family planning related roles. There, in particular, there was one on expanding health worker roles for comprehensive abortion care in India. There were abstracts around getting government buy-in for family planning funding or programs, case studies on advocating for government institutionalization of comprehensive sexuality education in Pakistan. That scored very highly last time. There's also a business case for investing in family planning from Nigeria. And finally, there were abstracts that featured innovative tools or methods for ensuring accountability for family planning commitments. So, for example, there was one on fostering subnational accountability through a decision maker-led internal assessment for family planning commitments in Kenya. And that is actually the example that we walk through in our abstract video presentation. So you could see each section of that abstract and how it really laid out the case and made it very, very easy to decide that this is one we wanted to feature at the conference. Oh, as it is with regular research findings, where both positive and negative results are important, are we interested in advocacy abstracts that show an effort that wasn't productive or not as productive as initially expected? And that's a great question from Coyote. So yes, I think absolutely we want to hear about things that were not productive or maybe that have mixed results. I think there's also in the abstract sections, there's a section on not limitations, but it's called policy or program implications. And so there's also an opportunity there to talk about what did not go well, what was unexpected, as well as where can you go from there, learning what you learned. What would you do differently next time, for example? So those are all important things and can give reviewers an opportunity to know that you know the limitations of your own effort, and it definitely gives more depth to a submission. Where can I find the conference book with the accepted abstracts from the last Icfp? That's a great question. Since I said you should go look at it. I think there will be a link. I believe on the Gates Institute homepage, there's a way to find past Icfp websites that will allow you to look at the accepted abstracts. Maybe Liz or someone who's supporting this can find that link for us, but it is searchable on the Gates Institute website.
Can I jump in? Linnea seems to be super efficient. She already searched that link and shared it with the participants. Well, Sarah, just to compliment what you said, it's more important to learn about what has not worked well, the failures. It's easy to replicate successes, but I think it's a great idea to learn from the failures of a program, from the failures of a pilot project, what did not work well. Let us take an example. Maybe in 2019, November, someone came with an absolute great idea that we should train health workers to go for home visits. And a great program was launched in a country or in a subnational level. And then when everything was ready, you had trained the workers and they were ready to go, and then COVID struck and no one went for home visits. So is it a success or is it a failure? There is an unseen, unforeseen, confounding variable that we had not taken into account. So, well, many countries would like, many projects and many programs would like to learn from these experiences as well. And they can be great examples. So, of course, successes are good, but we learn more from what should not be done or what should be done differently. So that's also an important issue. And I agree with you. Yes, this is what has also a good chance of being accepted. Thank you.
Great. So last call for advocacy related questions. I think now we're answering them all along the way, but we also have some dedicated time for program implementation abstract questions.
Maybe I can start just by asking Dr. Sharma the same question that I asked Sarah before. What makes a program implementation abstract stand out, particularly in that it often can have a lot of overlap with research. So what would you say, what makes an implementation abstract different from research? We talked a little bit about this already, but what really makes one stand out as exceptional?
Well, it's not an easy question because, as I said earlier, there's so much of an overlap. And of course, when you are working on a program implementation, you could come up with research, you could also come up with some advocacy. What the key question here is, what were the reasons a program was not successful, or what were the, as we mentioned earlier, what were the hurdles, what were the bottlenecks in a program that were hampering success or efficiency of a program. The second thing would be, what could be the socio-cultural factors associated with the staff were just not available. Or you had the products available, but the staff was not available. Vacancies, staff vacancies. There could be some program innovations that some country or some project decided. We discussed some program innovations earlier in the other research session. But there can be a number of issues that will relate to how a program can be implemented in a better way, or how a program succeeded where others were not. It could be because of the capacity development efforts for the health workers. It could be because of the, as I said, home visits. It could be something related to the program. It could be something related to the the providers, it could be something related to the a change in the behaviors, health-seeking behaviors of the community. All these are directly impacting how a program is being implemented in an area and how a program is going to likely to succeed or not succeed as we had visualized. So a number of issues here we have to take into consideration. It's the indicators, it's from the socio-cultural point of view, from the user's perspective, it's from the health systems perspective, it's from the provider's perspective. All these will have to be taken into consideration. And then all these are different topics or subjects that one could research, one could work on, to come up with a program implementation study. I hope, I know it's a bit confusing, but the question was equally confusing and equally difficult. Thank you.
So we have another question for you, Dr. Sharma. Besides other parameters, is regional diversity and representation one of the criteria for selecting an abstract? And how do you ensure that?
Yes, this could be, again, something of interest. It could be a inter-regional variation within a country. One region is performing very well and the same program in another region is not performing well. What could be the reasons? Again, as we mentioned, it could be socio-cultural reasons. It could be reasons related to the users, to the program delivery, that is providers, or how the program is being implemented, or it could be related to policy or changes, or it could be a study where you compare inter-regional differences between two countries. Or the best thing would be, as we said, you have within the same country, two different regions where the same program, the same national program has different indicators or different outcomes. What could be the reasons? How the deficiencies in one area or the limitations in one area are being addressed in the other area? Yeah, that could be interesting. Thank you.
And I think this may have been, and the submission was anonymous. I think this may have been in reference to is the program committee, or not necessarily, is the scientific subcommittee, advocacy subcommittee, et cetera. Do we ensure regional diversity in the abstracts that are selected for presentation? And we do take it into account, certainly. So after the abstracts are scored, track organizers will review the scores. They will and look to see what kinds of representation we have. And it's not a matter of only regional diversity. We also do want to ensure that we have diversity, and certainly in Anglophone and Francophone participation, regional diversity, in organizational diversity. We don't want the same, 3 organizations in every single session. We do consider trying to make sure that we have diversity and new researchers or new advocates as well. So we do take all of that into account. How do we ensure that? I mean, it depends on who is submitting. We aren't necessarily going to select an abstract that is of very poor quality just to ensure that we have some regional diversity. But we definitely do review the abstracts as they've been scored. Track organizers will review and select and arrange panels. And then the scientific subcommittees and each of the co-chairs will also look and review and ensure that we're doing our best to ensure that there is representation across a variety of criteria. I'm not sure if Sarah or Dr. Sharma, if you have anything else to add to that.
Just goes to show how words can be subjective. You say it's the same word, and you interpreted it in a very different way, which was, I guess, more correct. And for me, it was, from a program perspective, I was just thinking about different regions with the same program. But exactly, yeah, when we do take into consideration different regions, for example, a Francophone country, it doesn't mean that these are all going to be, one session is going to be all English or Anglophone or Francophone. We do take into consideration the regional diversity. So thank you very much, Linnea. I think together we have answered the question. Thank you.
So a lesson I think as well for writers is be very specific in your language and writing. You can see that it's very clear to interpret things in multiple different ways. So be as specific and clear as possible. Okay, this one is specific again for Dr. Sharma. So what types of data and evidence make a compelling program implementation abstract? For example, HMIS data, monitoring data, research data, qualitative data, etc.
Well, thanks again. I guess the answer is all of it together, or any single one of them would stand an equal chance. The baseline is the quality of research, the scientific methodology that is sound, and whatever you are presenting is clear. Whether it is an evaluation, whether it is a monitoring, whether it is a program-related data or indicators, it makes no difference. If there is something new, something that adds value to implementation to a program, that provides an insight, a new insight into what could make a difference to a program, I guess any type of research, any type of data would be useful. Just not, if we are not limiting ourselves to one particular type of qualitative or quantitative type of studies, or studies related to a large scale sample or representative sample. It could be something that comes up with that attracts attention of the readers, of the audience. Thank you.
I think if I might add as well from the research perspective, similarly, that any source of data is equally valid. I think what's really important to remember is that the reviewers that are reviewing your abstracts are all professionals in the field, and so it's important to remember that you probably aren't going to sneak anything past the reviewers. So if you know that there are flaws in your data, that there are known limitations of, for example, HMIS, or there's that your data isn't representative of a certain population, et cetera, that you don't have to spend a lot of time talking about that in your abstract because it's very short. But do remember that if there's any obvious flaws, that the abstract reviewers will catch those as well. And there's no opportunity for you to answer questions or justify in the abstract review process as there is in the presentations. So if there is anything that stands out as an obvious issue, you don't think it compromises the whole of your abstract, it is worth occasionally noting that. Because if we have questions about the abstract reviews and we can't answer them and reach out, then you will probably score lower than you might otherwise. So we have a comment in the chat. It's not exactly a question, but qualitative research in family planning is more effective and gives true figure. So I guess in just sort of response to that, I think we would say qualitative research is as encouraged as any quantitative research. Similarly with mixed methods, that they are very complementary, and I don't know that there's necessarily any preference for one over the other. So we have a question, are program evaluations conducted as academic research considered research or program abstracts? Dr. Sharma, why don't you go ahead?
Why is it all the difficult questions come to me?
Because I'm moderating the Q&A.
Well, okay, it could be both. Let me see the question again. Yeah, whether it's a program evaluation, if it is conducted as an academic research, or ultimately you are conducting a research, it makes no difference whether it is for a PhD or for a thesis or for a research paper. you are conducting a basic research, and the research has some valid scientific methodology and comes up with some answers, well, it is research. If it is a purpose for a publication or for a degree or a diploma, it makes no difference. You have conducted a research, and then I wanted to, and this is also included in the video. I think Linnea referred to it in a passing manner. When you are conducting a research, and it is very, very easy for some researchers and very tempting for researchers to sometimes have 4 or 5 research questions, hypotheses in the beginning, and then when you are reporting, you just present 1 or 2. You hide 1 or 2 where you do not find valid or very significant answers. This is not required. You could always say, well, out of the 4, 2 had some very positive associations or negative associations or significant associations, and in the other 2, we didn't find any association. So it doesn't matter. Please don't try to find where there are no findings. Let us be clear on what was achieved and what was initially the initial research questions were. And whether it is for any purpose, if it is a valid scientific research with a scientific valid methodology, well, it is appreciated and it is accepted. Thank you.
And I think just from the research perspective as well, to your question, I think that as Dr. Sharma has said before, that if the focus of your abstract is really on sort of lessons learned about implementation and what were the challenges, how you overcame those challenges, what worked in terms of implementation, that certainly fits extremely well into the program and implementation session. If the focus on your abstract is more about the design of the evaluation, what were the data methods used, who were your comparisons and your controls, and what was the final impact of the intervention or the program, that would it would fit in either one, but would also fit very well into the research abstract or into the research session. So I would say that it really comes down to how you're framing and what you're highlighting. And if it's more about how you do how you implemented an intervention, how you designed it, how you worked with advocates, that those are different, that those are either potentially for advocacy or potentially for program. If it's about what the actual results were and how you designed it and evaluated it, then that probably fits very well into the research area. But it isn't always a very clear and cut distinction. Should there be IRB for abstracts on programmatic research? I'm not sure I fully understand the question. If the person who asked might be able to provide a little bit more detail in their question, then we can try and answer that. In general, anything that you are presenting from an intervention should always have gone through an IRB. I think I can say that. But so ethical clearance for the data collection. So I think we would all agree that if you're collecting data from a population, whether that is for the purposes of research, for the purposes of program evaluation, or if you're collecting data from a population, even to evaluate the impacts of advocacy, that all data collection should go through an ethical clearance, particularly if the purpose of your data collection is to disseminate that research. So if from the beginning you know that you are, well, it doesn't matter if it's from the beginning or not, if you are disseminating findings, then that should have been reviewed by an ethical committee, and the respondents should have agreed to what should have gone through an informed consent, so that they know what you're doing with the data. Do you need proof of IRB approval or exemption when submitting Icfp abstracts? No, you don't, and you don't generally need to note it within the abstracts either. But as a good practice, if you're collecting data, then you should be submitting through IRBs. So I would say that in general, you don't need an IRB. You don't need IRB approval to share lessons learned. they aren't generally the experiences of individuals, or if they are, they're experiences of individuals within the program itself. So I think it's always I see we've lost Dr. Sharma. Oh, he's back again. All right, great. So Dr. Sharma, maybe you can just comment on whether there's guidelines of when the IRB should be used if you're talking about program implementation lessons learned.
Well, it's very clear. Most of the times, am I audible now? Okay. I think there was a problem with the internet earlier. Most of the research, when it is dealing with individuals, when it is dealing with people, in any case, all research should be cleared ethically from the ethics committee. But sometimes in some exceptions, for example, if you're working on secondary data or data from surveys, for example, data from censuses, data from National Health Surveys, National Family Surveys, this might not be required. But it is always a good practice to get it cleared, to get your research cleared from the ethics committee of either your institution or from whosoever the authority would be. And because sometimes when you're talking, for example, in a qualitative research, you're talking to individuals and you are collecting their personal perceptions. It's always good at the very beginning to tell them about what is being collected and how it is going to be presented, how it is going to be shared. So yeah, I think it's a very good idea. It's important. It's not a good idea. It's essential, mandatory to get that clearance from the ethics board. Thank you.
Sarah, do you have any thoughts on this in terms of advocacy, since I think often the data isn't necessarily coming from individuals in a population?
Yeah, it depends on the type of advocacy or accountability submission. You know, if there was an advocacy effort and you wanted to hone in on one key part of your campaign or your effort, and you wanted to go back and say interview some decision makers or policy makers as like a focus group, then yes, I think you would go through the same process that you would for any other kind of program or research evaluation or study. But you know, a lot of times programs you know, can get started without that if you're not technically studying a population, if you're sort of, you know, doing activities alongside other partners. So it kind of depends on the type of submission. And it's not uncommon also to establish a program in a certain context or country, and then, like I said, if you have more follow-up you want to do, to seek IRB, you know, even after a certain project has begun. So it's not something that's like, you know, if you don't have it, you're in a tough spot. You know, you can always go into an IRB as a special part of a project that's already ongoing.
So it looks like, I'm just looking through the chat here to see if there's any more questions. I see there's been just some notes about different methodologies that you can use and what might be appropriate in different locations. Hayek, thank you for saying we are amazing. I think we all appreciate that. If there's no other questions, I think that we may finish up the session. But we're happy to stay here in the event that anybody does have any final questions that they'd like to ask. All right, well, please remember to watch the videos if you haven't already. They're available in English and in French, and we will be making announcements about the timing and the timelines for the next ICFP very soon. So please watch out for videos and announcements for that. And those videos will be posted for some time, and I believe will also be on the YouTube channel, so you can download and watch them as many times as you need. So we look forward to seeing you all at ICFP, whenever it may be.
stars with the power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because